Well, today marks 5 years since the World Health Organization declared COVID-19 a pandemic. Questions remain from the origins of the outbreak to the effectiveness of public health interventions. But chief amongst them is, are we ready for the next pandemic? Well, the human race is no stranger to infectious diseases. There have been around 250 pandemics or epidemics throughout recorded history. One of the deadliest ever, the bubonic plague, took place in the 14th century. Estimates say it caused up to 200 million deaths, wiping out around half of Europe's population. Also known as the Black Death, the plague is widely thought to have originated from rats and spread to humans via infected fleas. In 1918, an influenza pandemic swept through the world, killing around 50 million people in the span of 2 years. More commonly known as the Spanish flu, some estimates put its death toll as high as 100 million. Another notable outbreak of the past is the New World smallpox pandemic in 1520. The virus was brought to the Americas when the first Europeans arrived on its shores. An estimated 25 to 56 million people died. While smallpox has been completely eradicated since 1980 with the help of the world's first successful vaccine. And it was also vaccines which played an important role in preventing the further spread of COVID-19. Around 700 million people were affected globally, with the virus reaching every single continent. 7 million people lost their lives, but the death toll is thought to be higher. The WHO, though, says vaccinations reduced deaths by at least 57%. The threat of the pandemic accelerated the development of mRNA vaccines, such as the ones created by Moderna and Pfizer-BioNTech. Now, this type of vaccine is new, but it is not unknown. Research into how mRNA could be used to fight disease began in the 1970s. Unlike traditional vaccines, mRNA vaccines do not contain any live virus. They help our bodies produce antibodies specific to the disease. Simply put, mRNA vaccines help reproduce the same immune response that happens in a natural infection, but without actually infecting your body. Now, the COVID-19 pandemic has highlighted the urgent need for swift and safe vaccine development. But some experts are saying that even with vaccines, it may not be possible to prevent another pandemic.
So we're joined by Yanzhong Huang, a senior fellow for global health at this Council on Foreign Relations. Thank you very much for joining us, Yanzhong. Firstly, if the next pandemic arrives this year, let's say, is the world ready? Are we doing anything better to prepare this time around?
Well, great question. My simple answer is no. And of course, we have made good progress in terms of pandemic preparedness, prevention, and control. We know that some countries have invested in faster vaccine development, AI-driven outbreak detection. We have seen more government rolling out pandemic preparedness response plans. We are seeing more nations adopting so-called Western water surveillance that is very effective, for early outbreak detection. It's the and at the international level, we are seeing the launch of the pandemic fund, right, which is launched by the World Bank and the WHO, the World Health Organization. That fund's supposed to support low and middle income countries in strengthening disease surveillance, health workforce training, and emergency response. So far, we have over $2 billion, being pledged. These efforts not adequate. In fact, we are seeing the funding gaps, geopolitical tensions, public trust issues, etc., continue to be key challenges in disease or pandemic prevention and control. If you look at the national level preparedness, many countries underfunded their health systems after COVID-19, leaving hospitals, health agencies without adequate resources. We are also facing the problems in terms of stockpiles of essential medical supplies, like PPE, ventilators, vaccines remain insufficient in many nations. There is workforce shortage problems that was exacerbated by the burnout and migration of medical professionals worldwide. There's this problem of coordination, between local and national authorities. And of course, also at the national level, we're seeing the second Trump administration's assault, right, on U.S. outbreak preparedness, right? The so-called slash and burn campaign has actively, effectively silenced the U.S. CDC and is dismantling, right, the infrastructural U.S. rely on to detect and confront the deadly pathogens, that is happening in organizations like the NIH, National Institute of Health. And then, but really what worries us is what happens at the national level, essentially lack of coordination between countries. So we are not ready. In a way, I would say it's safe to say that if another pandemic hits, we are even worse than 2019 in terms of preparing for the next pandemic.
Yanzhong, I hear you. So funding is one problem, coordination is another. I want to ask you about some of the lasting, if you like, impacts of the pandemic on the healthcare system as well. I mean, those related to economies, job losses are well documented. We're still feeling some of them today. I'm wondering what sort of impacts is the healthcare system still feeling from the pandemic that we haven't quite recovered from?
Well, that certainly varies across countries, right? That one of the direct impact on the healthcare system strengthening is like for some countries like China facing this economic decline in a way associated with the draconian zero COVID measures, right? So the sustained economic decline actually is contributing to a fiscal crisis that make the local governments in particular, by having less incentives and capabilities in investing in healthcare infrastructure building. And in the meantime, there's sort of a lack of public discussion or discourse on fixing, right, the loopholes in the public health structure, right? So that is still, right, I think one of the weak link we are identifying in terms of pandemic preparedness.
Yanzhong, I mean, in some countries, particularly the US is an example, the pandemic caused deep divisions and led to a lot of fake news as well. I'm wondering how much of a problem this still is today in terms of building trust in public health institutions and reaching out to people during potential outbreaks of disease.
Yeah, I think that is still a concern, right? That basically the government struggle to combat, right, the misinformation, disinformation, that weakens public confidence in vaccines and response measures, and equally important, it weakens their trust, right, in public health agencies like US CDC, right? We know that public health is built on trust, right? If people don't trust why the vaccines are going to work, if people don't trust the health professionals are going to do a good job in pandemic preparedness, then you can't count on their cooperation, right, in the pandemic response. And unfortunately, now we have, like in the US, for example, we have a new administration. By the new HHS secretary, by himself, was a vaccine skeptic, right? There's a cut in the National Health Institute, the NIH funding in terms of indirect cost rate. So we have seen by this problem of misinformation, like the effectiveness of vaccines, but continue to haunt many countries, not just the United States, but other countries as well. So when the next pandemic or outbreak hits, that I think it will be an uphill battle for countries, the public health agencies to convince people to inject the vaccines.
Sure. Okay. So, Yangzhou, WHO warning that health systems are buckling under the strain of multiple crises. We were talking about war, climate change, economic crises. What sort of investments need to be prioritized now to strengthen health systems in anticipation of future pandemics?
Well, that is always the concern, right? And now, right, we used to have the problem like WHO. There was like a budget problem because of the lack of funding, for the operating budget. That situation improved since COVID-19, right? And also there was a launch of the pandemic fund, right, to strengthen like disease surveillance, health workforce training, and emergency preparedness. But now, what the U.S. is leaving by the WHO, is we know that the U.S. supported, right, almost like 18% of the WHO operating budget, and it is unlikely for China to fill that funding gap. So again, you're at the international level, you are seeing, right, the funding crisis for achieve the coordinator for pandemic response. And at the national level, you've seen many countries actually have not showing any strong incentive to invest in public health, right? And in the meantime, we're seeing the challenges, the multifaceted. It's not just that we talk about, right, the pandemic outbreaks, but also other issues like non-communicable diseases. For example, in China, we're talking about sort of like a obesity or the diabetes crises.
Okay, Yanzhong, get your point. Thank you very much for your insight this morning. We'll have to leave it there. We've been speaking to Yanzhong Huang, Senior Fellow for Global Health at the Council on Foreign Relations.